It's yet another beautiful Thursday, ladies and gentlemen. Tonight, this is The Alternative Voice, and I'm your host, CLEOPHAS. OLUOCH. As always, we always have this great discussion every Thursday night at 8 p.m. And here we are, a minute past 8, and joining us live in this discussion will be someone who is well endowed in this topic of today, and that's healthy living. Tonight, we're talking on how we as young people, as the elderly people who are watching this live broadcast from Nairobi, Kenya, all over the world, in India, Russia, whichever part of the country you are in, join us tonight and let's have fun as we discuss and engage in this great discussion. So tonight we're going to have a question and answer session with Dr. Omamo. Dr. Omamo, if you can hear us, kindly join the discussion. Yeah. Kindly feel free to join this great family of the Alternative Voice.
Thank you, CLEOPHAS. I want to first of all congratulate you for this great platform that you've initiated. I think this is by far a very innovative way to interact with the audience. I think I'll start, so because we do have 1 hour, and we need to maximize a good chunk of it. I think I'll start with just a brief introduction of who I am, and
yes,
then I'll drive straight to the topic, and then it's more of an interactive topic, viewers. So we'll expect your question. It will be a question and answer session. There won't be any or a lot of medical jargon. It will be plain, simple English that you could understand. My name is Omamo Ndai. The K is still a name, though it stands for Kevin. I'm a medical doctor, doing 11 years post-training or post-graduation. Currently practicing as a wellness physician, and also furthering my skill in the surgical field. I'm affiliated with the Harvard Medical Center and other organizations that for the purposes of this broadcast. Now, we are based in Kisumu, and I also work within other towns in the Nyanza region, Migori, and I also reside in Bondo. So basically all over. For the purposes of this talk, yes, CLEOPHAS.
Thank you very much for that wonderful introduction. And even to those people who don't understand who Dr. Omamo is just the son of the soil, and he's someone who went through the same system that we go through here in the country, and that's where he graduated from the University of Nairobi. And so, taking us through the discussion tonight, dear viewers, is Dr. Omamo Ndai, and the discussion tonight, our topic of discussion is healthy living. What can we do to ensure that we live that healthy life, to avoid some of the lifestyle diseases that come through as a result of lack of being physically fit? So stay tuned wherever you are. We are 4 minutes past the top of the hour. That's 8 p.m. in Nairobi, Kenya. And joining us live to dig deep in this discussion is Dr. Omamo. So kindly take us through this healthy living in these times of COVID-19, and even after this COVID-19, how should we enhance this healthy living lifestyle? Karibu sana daktari.
Thank you, CLEOPHAS. I think from a start, we need to have a definition or an understanding of actually what healthy living is, because sometimes there are misnomers or misunderstanding of what it is to actually live healthy. I think if I borrow from the World Health Organization or WHO, that states that health by itself is not the state of an absence of disease, but it is the fact that you are whole or having a wholesome, healthy living. It means that you are physically healthy, you are socially healthy, you're mentally healthy, and you are even economically healthy. And I know during this time of COVID-19, some of those aspects of health have been affected. So I know that a lot of people, when they hear healthy living being talked by a doctor, the focus is usually on the physical living, and the physical well-being. And I'll focus more on that. But also we drift on to talk about mental health. I think about economic health. We had a talk last week concerning debts and all that, which impact generally on your health by increasing stress and every other thing. So for in terms of physical
Yes.
living or physical healthy living, I'll start by saying that young people are fortunate during your youth. This is the fact of reality physiologically, because your organs and your muscles and every other aspect of your life are at optimum when you are youthful. You are able to undertake activities that in between the age of 15 and maybe 49.
Yes, seemingly we are not getting Daktari on that point, but ladies and gentlemen, we can see the essence of living healthy life. And up to that point, 8 minutes past 8 p.m., we are in this discussion and we can realize ya kwamba healthy living as that physical wellness, mental wellness, and also we have the economic wellness. So it's upon us as young people to decide which part of this track would we like to go. And on that note, we would like to request you to join us this live discussion. Bring your questions to Daktari. He can be able to handle some of the questions or even all the questions that you'll be asking tonight as far as healthy living is concerned. Remember, we are hard hit by COVID-19 in our country, and I think it's the right time for us to have this discussion. We have those people who've been thrown into depression, and that's mental illness, and that's now you don't have that mental health with you. So join us in this discussion. This is the alternative voice, and if you're joining us for the first time, feel free to share with us the comment. Daktari will be back in a few from this time as our technical guys are working to bring him back online. But meanwhile, you can share with us on the comment section section there is and sorry for that network problems. And so here we are. as the alternative voice, 10 minutes past 8 p.m. And we are still talking matters healthy living. So to join our live discussion, kindly go to our comment section, pick the StreamYard link, and you'll be able to join us live. Millicent Ochieng anasema ako tuned from Kigali, Rwanda. Journalist Samuel Oriwo tuned together. Watch kutoka Siaya. Presenter Mokaya Tupundani, thank you very much, bro. Kevin Amzil tuned from Gilgil. Esinjoroge tuned, thank you very much. And on that note, where we are, we can be able to see all these people who are joining us live. Daktari will be back in a moment. Some network issues wherever he is tuned or where he's coming live from. And our discussion tonight is healthy living. Welcome to our page, The Alternative Voice. And on the comment section, you can join our discussion live at that point. And now if I can bring any other viewer who is live with us. I can see Millicent, Esinjoroge, Kevin Amzil. I would like to have Kevin Amzil on this discussion if he's available to keep us going. And so we can see our guest tonight, Dr. Omamo, who is also practicing in the both private and public sector of our economy, a graduate from the University of Nairobi, and also pursuing some master's degree in management and planning. Someone who will really understand the importance of us tackling the issue of mental and economic wellness. We are glad to have you back, Daktari. If your internet connection is still intact, if you can continue from where you stopped.
Yeah.
You have so many people tuned, and so here from Nairobi, Kenya, a number of them are tuned. And if I can go through those who are tuned, we have presenter Mokaya, journalist Samuel Oriwo, Don Applejaka, Kevin Amzil, Esinjoroge, Millicent Ochieng, who is watching us live from Kigali, Rwanda. So check us through where we stopped.
All right. Are you able to get me? Sorry, the internet just decided to mess up. I had to move a little bit. All right. So we were actually discussing on the aspect of having the basics of healthy living, going through the things that people can do without necessarily spending any money, like taking water and ensuring that you're well hydrated. The next thing that I would advise, and also I practice a lot, is exercise. And to be able to let people know is that exercise does not necessarily mean that you go to the gym. You can do certain exercises, stretches within the confines of your house, within the confines of your compound. Running up and down the steps has been proven to be as effective as going to the gym for 30 minutes. I see a lot of young people getting into cycling, into running in the morning. This by itself is very healthy, because the more you keep your heart pumping, the better it is for you. Because as I said, if 60% of you is water, you need that water circulating and not getting into areas where it will cause problems, like having hypertension, high blood pressure. Now, the other thing that has been emphasized over the years and has gained traction in our setup, yes, is diet. And we have a lot of issues dealing with diet. I will just ask you and maybe a lot of the other viewers if any of them have had to calculate the BMI, or what is called the body mass index. And the BMI, or the body mass index, is simply a fraction of your weight divided by your height squared. So like me, I'm 78 and my height is about 1.84. So you square that, then you'll be able to get a BMI of about 23, 24. There are certain ranges that work within the nutritionist books, but definitely a BMI of over 30 is always dangerous. You have risks of obesity, heart attack, diabetes, and other disorders that will affect you. Again, a BMI of 18 is underweight, and so keeping yourself between 18 and 30 is usually recommended as a good place to be for healthy living. So, CLEOPHAS, just to give a brief overview, those three elements of ensuring that you are hydrated, ensuring that you are able to undertake certain level of exercises, and ensuring that the diet that you have is adequate enough to provide you the necessary nutrients you need and the necessary energy that you need to operate on a day-to-day basis. I'm not a junk food guy, and I know most of our generations guys like KFC and going to big pizza, whether it's medium large or extra large, with pepperoni and sauce and a little bit of onions. I'm seeing you're you're actually licking your lips. So I mean, it's never wrong to and chips on top of it, and a big Coke bottle, you know, the 2 liters one. I've seen actually people consuming a 2-liter Coke, amazingly. And all this junk food have a way of increasing your risks of getting diseases like diabetes and hypertension, especially if done consistently and without burning those calories. So we are in the medical profession, we are seeing a lot of young people coming to us with diabetes, with hypertension. I have heard as young people as young as 22 with diagnosed with hypertension, and some of these things are lifestyle disorders that can be modified. We call them modifiable diseases. On modifiable lifestyle, you can modify them by changing your lifestyle, and the disease will be in control. Yeah. So I think that's what I will do, and then we can get into the question Q&As if there's something.
So, Dr. before we get to the Q&As, because they are coming in thick and fast tonight, and this discussion is bringing jitters in the room because most young people are here and they are practicing the opposite of what you are advocating for. And so, before we move to that session of question and answer, and before you also come back to give some more highlights on this, I would like to know, when we have both the young and the old in a setup, let's say in a family, these two kind of generation, they cannot have similar exercises. Let's say if my mother is at 65 years old and she has already these lifestyle diseases with her, and me in my capacity, if I'm this young and energetic, the kind of exercise that I can do is different from what that elderly person can do. I know there are some here who are taking care of their elderly mothers, elderly brothers, even fathers, even their grandparents. They're here and they would like to know, what kind of exercises should these elderly people take? Those who have not yet contracted the lifestyle diseases, and those who are young, to ensure that they keep healthy and to avoid the lifestyle infections, Dr.
That's a brilliant question. To answer that, again, exercises and all these things I'm saying, there's nothing cast in stone. Every person is able to do that which fits into their abilities. I would advocate this. This is what I tell let me start with the older people, the very old. Let me talk about the group we call the geriatrics. We're talking about people who are in their 75 to above. Most of these people cannot engage themselves in very active exercises. But if you could do just step ups, a step up is you get even a hard surface, and you're just stepping up, down, up, down for a period of 30 minutes. The idea is to ensure that the heart is pumping right. The idea is to ensure that you can at least appreciate that you're sweating. And you don't have to do it that 30 minutes to be done consistently. You can spread it over 10 minutes, rest 5 minutes, do 5 minutes, rest 10 minutes, until it's comfortable. Again, I would advocate that too much exercises is also not good. Especially now, as I talk about the young people, that people go overboard with exercises and lifting weights, taking on steroids, and trying to pump up. Some of these things have very bad side effects that affect you later on in life once you are now settled down. So my idea again for the mid group, I'm talking now about maybe the age between 50 and 75, is that they can engage themselves in as much as activity as the other young people. I think if you go to YouTube or even other social media channels, you'll see guys 75 years and they're lifting weights, they're running just like they do, even better than other young people do. It's what is comfortable to you. It is what gets you moving. The most important thing is that ensure that you are doing what is called cardiovascular activity. You're feeling your heart pumping, your body, there's some sweat coming out, but not necessarily panting. And that's what I do. For me, I may not be able, because of my schedule, I may not be able to be running and everything, but once in a while, I take a long walk, about 7 or 10 kilometers. The people who I know who do cycling every so often. The idea is not to prescribe something specific. This can be done on a individual basis, but for the purpose of today is to open up people to the idea that this is something that can actually be done and low cost, without necessarily having to spend a lot of money. I don't know if I've answered your question.
Yes, Dr. That's well elaborated. And taking us to that point of question and answer before we take a short commercial break, this is the 22nd minute past 8 p.m. and we are live on the Alternative Voice. And the topic of discussion today, if you're joining us live on Facebook and YouTube, we are talking about healthy living. And healthy living, Dr. has highlighted, we have three types. We have economic wellness, mental wellness, and also we have the physical wellness. We'll be coming back with more questions for Daktari. And now we have a viewer who is here to ask a question. And the viewer is joining us live from India. If we have Meshach Charles, kindly unmute yourself and ask Daktari the question.
Hello.
Yes, we can hear you, Meshach. Go ahead and ask Daktari the question.
So my question is, Doctor, if okay, I would like to point on BMI. Is BMI really accurate on calculation of body weight? Because I do understand, but some of us can have muscle and fat. So to some extent, I think BMI cannot be in a position to differentiate between muscles and fat, which means somebody with muscle can be termed as overweight without considering the fat content of the body. So is this BMI really accurate? Thank you.
Yeah.
Yes, Daktari, if you got the question from Charles.
Yes, Charles has brought up a really important issue that a lot of physicians, even nutritionists have grappled with, because BMI was initially used as a one-off decision to determine whether somebody is overweight, obese, or moribundly obese or morbidly obese, and that was used to tune in medication. As he has pointed well, the people who have a lot of muscle, that with time, then if you just use BMI by itself, then you get an accurate reading. But BMI is not a standalone. I mean, when we are doing numeric tests, or when you're assessing weight, and when you're assessing whether you qualify for treatment or you're calling for diet modification, the other things that we look at, apart from the body mass index, we look at what we call the truncal girth or circumference. yani inamaanisha uko na kitambi ama una kitambi, because unajua when you have kitambi for those people who are not aware of Kiswahili is just the bump in your stomach, but you're not pregnant, and that increases again your risk. And that increases your risk of having other lifestyle diseases, because that shows that you're depositing fat in areas where fat is not supposed to be. We look at your arm, and we are able to measure the amount of fat that you are depositing all around the areas of your arm. We look at your hips, because those are areas where it collects. Aside from that, we also able to do other further studies that will able to say that this is person who necessarily needs to modify their diet. So I agree with Charles that BMI by itself is not cast in stone, and it is not supposed to be used as a one-off and to make decision. But by and large, a BMI of over 30 is associated more often than not with obesity. More often than not, and especially in our setup, because we take a lot of this from the American setup. So when you look at the African American, the people who we may closely share genetics with, a BMI of more than 30 and is considered that you're going from overweight to obese, and sometimes to morbidly obese. So I use it cautiously when I'm dealing with my clients. I don't necessarily just use it on off. I have other tools that ensure that the patient is able to adequately utilize, instead of just using one, because your BMI is 28 there for your and you need to do this. So I hope that is that on.
Yes, thank you very much. Thank you very much, Daktari. And we are on that point, ya kusema how we should be eating. There's a point, Pastor Nganga, and if the production team can have that clip for Pastor Nganga playing just for a few minutes huko mwisho. Mala anasema hata toa kidney kama umekataa. Yes, the production team
hizo carrots umekula nyama kiwango gani? Basi tafuta madaktari wakufundishe kukula. Si kukula sima nyingi, unakula sima kidogo na mboga nyingi. Una balance hizo. Mwili ni yako. Tusubue hapa sasa sijui maini, sijui imeshindwa kusiaga, ukunywe pombe, ukule nyama, ukule mutura, ukule vichwa vya ng'ombe, mwokotaji wewe, ukule ungangano, ukule mandazi, ukule mchele, mulafi wewe. Then useme ati kidney imekataa kufanya kazi. Utuchagisha hapa tukupatie kidney. Siwezi kukupatia kidney yangu. Wewe umekula yako. Usinitishe kidney yangu na mimi usinipatie yako.
Umesikia kitu Pastor Nganga amesema hapo kama
Pastor amesema kidney yako.
Very action on that.
I think we need to take into context what the man of God, I would say that because out of respect, because I know he has followers, he's saying, and he's simply saying, if you look at the context and the bigger picture, without decide going into the nitty-gritties, is that if you stuff yourself with foodstuffs that have high caloric intake, without necessarily being able to balance the food or balance the diet, you'll get into a situation where there's an overload of this in your body. And then what this causes, that it predisposes you, or it more often than not leads you to develop lifestyle diseases like diabetes and hypertension. And diabetes and hypertension, the two cousins, patients, the two cousins, are the number one cause of kidney disease in our country for now. And that's why we have a lot of people in our hospitals in need of transplants or in need of new kidneys. So if you were to look retrospectively at what Pastor is saying, is that take care of yourself. to a point that your body will not necessarily have to need an extra help from extra. Because what the other thing that people don't understand, and I think I just not want to bring it out, that once you develop kidney disease, or what we call end-stage renal disease, you have only two options: either you stay in a lifetime of dialysis, or you get a kidney transplant. And when you do get a kidney transplant, you are on lifetime of drugs to ensure that that kidney is not rejected. So the choices here are, which one is easier? Do you start having a healthy lifestyle early on in life, or do you wait for your nyama choma and everything that you take and wait at 60 years and ask for a transplant? So I think that's the gist of the message.
Thank you very much, Daktari, for making us understand what the man of God, Pastor Ng'ang'a mwenyewe alimaanisha. And so on that, we bring the question from presenter Mokaya, who is watching us live from Nairobi, Kenya. Last time nilisema na watch from Kisii, karibu nipigwe CBD ya Nairobi. What are the effects of using medicinal method of cutting weight? Yes, that's the question from Mokaya.
Yes, from presenter Mokaya. Again, any medicine, be it herbal, be it conventional medicine, in the right doses and with the right research, helps. I only know which specific ones you are using to cut weight, but all I know is that the most effective way to cut weight is to reduce what goes into your mouth. That has been identified as the most effective way of reducing weight. And if that does not occur, then there are other aspects that have been introduced, like doing bariatric surgeries that some people have it's something that's happening. Some of my senior colleagues are already doing bariatric surgery that is reducing the content of your stomach. Again, it's what goes into your mouth. There are people who genetically are predisposed to increase weight. It runs in the family. But again, it is what goes into your mouth. I think the Bible says that it is what goes in that is it what goes in or what comes out. You'll be more predisposed on issues of Bible more than I am. But what goes in medicine is more dangerous than what comes out, because what goes in ensures that either it is productive for yourself or not. Yeah. I would encourage people to do research. If there are herbal medications that work, because some of these sometimes are laxatives, and laxatives are medications that cause you to, what they do, let's say quote colon cleansing. They just ensure that you unaharisha. Some of them are traditional and local. I've used a few when my stomach is bloating, so I've also used some of those. But their side effects have not been researched, unlike the conventional ones. So I would be cautious to overuse them without proper instruction. I know there are also doctors who are also well adapted in using herbal medication. They would be more inclined to give appropriate answer in this aspect more than myself. But I would say in the end that whatever you take, anything you do it in moderation, and do it knowing exactly what you're getting into. I will not prescribe a particular drug or promote a particular brand, but I know there are things Masai is used. That's why most of them have lean body mass and other things. But those have to be, things you're doing what you know what to do. I don't know if Presenter Mokaya is satisfied.
Yes, that explanation is clear, and here he is again with another question. Presenter Mokaya, umeambiwa reduce what goes into your mouth, punguza yanayoenda kinywani mwako. Yes, hiyo ni ndani. Yes. So Presenter Mokaya anauliza tena, can the lifestyle disease be corrected in a separate text? Can the lifestyle disease, if I can get that again, can the lifestyle disease be biologically transmitted? Yes. For example, can a mother transmit it to the kids?
If I were to answer that, it's a yes in this manner. Children whose parents and first relatives have diabetes, or what we call the type 1 diabetes, are more likely to develop diabetes, because there's always genetics that play in. It's like cancer. If you have maybe your mother or your aunt or a close relative like a sister who's had, let's say, breast cancer, you will find if you do a screening, you will most likely find that gene running, or that gene defect running in your family. And if you had a think about this actress called Angelina Jolie, most people will know her. I don't know, CLEOPHAS, I know you sing, and I don't know if you know Angelina Jolie or you heard about her.
We know. Yes.
Yeah, she did do, if I'm not wrong, she did do what is called a prophylactic mastectomy, which she removed her breasts for the purposes of preventing cancer, because in her family, the tree, there's cancer. So yes, because of some genetic predisposition, a child may be likely to develop certain diseases that are transmitted in the family tree, and not only the mother, even the father. A boy probably gets something from the mother and the father. The girl gets something from the mother and father. Everybody gets something from the mother and father. So from every tree you could get something. But there are some diseases that are more predisposed, like children who have sickle cell anemia, and it's very prevalent in the western area of Kenya. You'll find that they develop kidney diseases easily. But specifically, just apart from diabetes, hypertension, which can also run in families, by and large, also some of these things can be controlled and prevented. Apart maybe from diabetes type 1, which children start insulin as early as 8 years. So we need to define that lifestyle diseases are what comes from the lifestyle. But if there was a chance that you could get it and you have poor lifestyle, it will make it worse. I don't know if I've answered Mukaya on that aspect.
Yes, definitely that's well explained. And if we can get some few comments, then we take a short commercial break. If we can get the comment from Don Epo, Timothy Obino, I'm tuned. Don Epo anasema, Daktari. Yes, we've not gone into the watershed hours. But anasema hapa, is Kunyonga healthy? Yes, Don, go back to the question. Yes, Daktari, is Kunyonga healthy? It's a crazy question, but I really want to know, does it have the side effects? Especially during this time when we find people, they are taking most of their time at home, and young people who are actually watching the show, some might have been in this situation. Don is asking this question on behalf of so many people. Yes, Daktari.
That deals with a lot of sexual health issues, and there are controversies on what is called kunyonga or masturbation. And strictly speaking, to the Christendom, they consider it a sin. So I think to the Christians, it's something that they don't even want to have it done. Now,
yes,
there are some papers and studies out there that have shown that the side effect it has is that it leads to addiction. So there are people who become addicted and then their sexual health is affected. So that is a side effect that is been documented. Benefits have been shown, especially in prevention of prostate cancer, that ejaculation 3 or 4 times a week helps in reducing the risk of developing prostate cancer. But this was done in patients who were in marriage. So Kunyonga does not, as much as it gets the work done, but it was not being actively pursued. again, by the time I think you're Nyongaring, I think the desire or the ability to be able to have your sexual health in place would be something I would want to talk to a patient about, because some people get addicted to a point where they cannot perform, and ladies may complain that they're not able to interact adequately. So it is a fine line to draw that issue. I would want you probably to host one of my sexual health colleagues. They will be more willing to talk about this Kunyonga business that Don really would want. For me, I think it's not something I would encourage young people to do. The same level, I think, because of testosterone, you will have that urge, but you can actually burn calories and get engaged in sports and activities that will be able to have almost the same effects that you'd want to get.
Thank you very much, Daktari. And on that note, if the person who asked the question, Don, kama una feel kuna vile mwili inataka kumisbehave, enda ukimbie, vile daktari amesema, choma calories, enda nje usweat, piga mpira, just to ensure that you keep up. We are running some of the questions asked. Then after the break, we'll go through them and Daktari will give us his final take. And in the next 9 minutes or so, we should be done with the tonight show. So we go through the comments, those who are tuned from all over the world. We have those watching us live from Rwanda, from Nairobi, Kenya. We have those in Kigali, Rwanda, and also those in India. We have Russia representatives. Shak Charles, that's Meshak. Daktari, is it true having many sexual partners? Daktari, if you can just note them somewhere, maybe after this break, you can just come and answer them. Meshak is asking, Daktari, is it true having many sexual partners makes one vulnerable to cervical cancer in women? What about in men? Any effect? Yes, that's the first question from Shak Charles. We'll be getting the feedback or the answers from Daktari. And Don Epo again is at it. If one can go for scans without a cancer diagnosis, yeah, okay. Is one, I think, if one can go. Yes. Yeah. Daktari, you got that?
Yeah, I got that.
Yes. Now for Shali Wambinya, this show is quite informative. I've learned quite a bit on the dieting and weight aspect. Thank you very much, Shali, for always joining us live on Facebook and also for keeping us active in this conversation. Nicole Caroline Omolo, who is watching us from Nairobi, Kenya, so much educative information. Thank you very much also for tuning in. And we get the next comment from Shanice Obongo. Great job, CLEOPHAS. I think this credit all goes to the viewers who keep us company in this live show, and also to Daktari who spared his time to be here with us. Thank you very much, Shanice, for tuning us despite your job schedule. We have Sam Braxel, Chief Sam, watching us from Nairobi, Kenya. We have Shadak Nderitu, who is also on Facebook, who is tuned. So, Daktari, from the two questions that we got, one from Don and one from Meshak, if you can respond to those two questions.
I'll respond to the first one from Shak. Yes, studies have shown that multiple sexual partners, especially having unprotected sexual intercourse, increases the risk of cancer, cervical cancer, not only in cancer but also in men, penile cancer. Also, we are in the age of HIV and AIDS, and a concurrent infection of HPV, which is associated with cervical cancer and penile cancer, and HIV provides a more poorer prognosis or an outcome compared to just having one or the other. So yes, it's still something to be talked about, that sex, as much as it's a human necessity, it needs to be practiced in a safe way. Abstinence, be faithful, and using protection has been a clarion call for the WHO. I would still insist that it's ABC that is still key, because we are seeing a lot of patients who are having penile cancer and cervical cancer. And on that note, I would advise all our female viewers to at least do every year a pap smear. This is a service that is offered free of charge in our government hospitals. In November, we have a cervical cancer screen drive in most facilities, and pap smear are almost always done for free, so that it is a screening. And cervical cancer, when diagnosed early, is treatable. I'll insist that it's treatable. So it will be important for us to note this, that having a multiple, it doesn't matter whether it's at a time or entire lifetime, the risks are similar. Shaq. So multiple, well spread over or at once, still the risk is still higher than just having one partner, especially unprotected. The second one was what was the second one? I have taken 2 questions from. Yes, that can you go for scans without I only know what that will mean, but I would say this. There are facilities, and including the one that will be advertised, that offer what is called an annual wellness screen, and you can actually do screening without necessarily having a diagnosis. Again, it is not recommended unless you're seen by a doctor, because also radiation that is on some of those scans, apart from ultrasounds, have risks. And to me, even a 0.1 or a 1% risk is still a risk of causing radiation. Radiation has a risk of causing cancers. So I would advise that get to see a personal doctor. Get an annual checkup, and know that after that the doctor may order test based on what he has seen. But just walking into a facility and say, I want a CT scan or an MRI, I wouldn't recommend that for the purposes of resources and also the risk of radiation exposure.
Thank you very much. And we have the comment just that came the last on our comment section. That's from Millicent Ochieng from Rwanda, Kigali, Rwanda. Thanks so much, Daktari, for the educative session. Really learning a lot. Thank you very much, Millicent, for always being here with us. And so on that note, we are going for a commercial break, and for our commercial break, tunajua tunaleta mdhamini. Mdhamini ni yule ambaye amefanikisha show yetu kukua hapa. And so we go madukani, tuone kama tunaweza lipa 1, 2, 3 kisha turudi production.
Welcome to Ahava Medical Center. We are located at Konamaji, Manyata, opposite Kisumu Elite Academy, Kisumu County. At Ahava, we offer general and specialist consultations, laboratory services, pharmacy, mother and child clinic. We also offer inpatient and maternity services, including Linda Mama. And soon, opening up our theater services. We accept NHIF and other insurance companies. Choose Ahava Medical Center as your facility of choice today. Call us on 0714-815-323. Follow us on Facebook at Ahava Medical Center, Kisumu. Ahava Medical Center, healthcare with compassion.
Yes, and that's Ahava Medical Center in Kisumu, Konamaji in Manyata, and that's where also if you have any of your concerns, those screenings that Daktari has been talking about, you can go to Kisumu Ahava Medical Center and you can call 0714-815-323 to get your services done. Na tumesikia kwamba ladies were watching. Nimeona sana wengi kwa comment section. Mmeambiwa muende hii pap smear. Pap smear is free in most of government facilities. Wherever you are, kindly go for that checkup at least once a year as advised by the doctor. And the other tests, if you have to do them, kindly go there when prescribed by a medical professional. And so on that note, Daktari, kama unaweza tuambia tu at Ahava Medical Center, which is based in Kisumu, kama tunakaribia kumaliza, and if the viewer outside there who is watching us live, drop your last comments here, because when we come back after this, we are bringing this discussion to an end. So Daktari, at Ahava Medical Center, how do you ensure that people of Kisumu County and even those people from other counties access to the services that you offer in your facility?
I think the critical thing to know is that the scope of services that are offered are it's a private medical facility, and it is NHIF accredited. So with your NHIF card, you can virtually get free treatment, and also it's cash paying, but it serves the low society, the low in the society. The consultations and other services are affordable because they are tailor-made to the community. My experience with the facility is that there's a focus on patient care and ability to be able to interact with you and ensure that you are able to know what the client requires. It is well staffed. My being there, I noticed it's well staffed with nurses, clinicians, with a well-equipped lab and pharmacy. And as he said, it's in Manyata, so the people who are within that catchment population are able can walk in Kisumu. I don't think they do have any other branches anywhere. I think it's just domiciled in Kisumu. And so that will be my comment concerning that. And I think the number is flashing. That number is 24 hours. In case of any need, it could be called. And yeah, thank you.
Thank you very much, Daktari. And if we get those or the comment section, if we have Charles for the last comment or question to Daktari, if Charles is online, if you can get Charles for the last final question, ama kama alishauliza, we can. Is Charles with us? Seemingly the question had been asked by Charles concerning
the multiple sexual partners.
Yes, multiple sexual partners. And so, Daktari, as we come to the end of this discussion, what message do you have to those parents who during this pandemic have really kept their children indoor and they've not practiced this physical wellness? And also to those parents who've been hard hit with this economy through the closure and the shutdown of our economy as a country, and even those people watching outside the country. The economy has been disrupted to mean our earnings has also gone down. That has brought in the issue of mental illness and that unsteady state of mind. So what word can you have to such parents?
As a parent, first of all, I am a parent too. And one thing that I advocate, I know there's pressure for children to understand information and go back to school. We still don't know if and when they'll go back to school. When they'll go back to school. They'll go back to school, but don't know when. But I have this philosophy that I let the children play. Play by itself has been shown to be beneficial not only to the physical well-being of children, but also to the cognitive ability of children. They're able to learn more when they play. They're able to interact with the environment when they play. So keeping children indoors, watching TV, playing games with PS4, PS5, I wouldn't advocate as a doctor, because sedentary lifestyle by itself, that is just sitting down with what God has blessed you for a long time, is associated with high risk of lifestyle diseases from a very early life. We're having you are seeing children with childhood obesities as young as 8 years. So it's not something that is to be overlooked. Parents, let your children play. Najua pesa ya sabuni inaweza kuwa nyingi, but let the young ones, interact with their colleagues. For the purpose of mental health, as one also who has undergone certain aspects of mental health, I would encourage people to develop strong social support system. Have people who you talk to on a regular basis. The English say that a problem shared is half solved. Number 2, seek help. Always never share around, especially if you're having thoughts that may be towards harming yourself, what we call suicidal thoughts. Don't take them for granted. When you are finding yourself soulless, not wanting company, or having anxiety, getting worried, these are the times that you may need to talk to people. That's what they call communal therapy or social therapy. And then there's the individual therapy where you now can go to a doctor. It is a big issue, especially with COVID. We've noticed and we heard that even gender-based violence has increased during this time of COVID. So seek help, seek it, and never be ashamed that you are dealing with aspects of mental health, because you're not the only one who is going through it. Many people are going through it, and there's always a way to ensure that you come out victorious. I think that's a comment to make on those aspects that you've asked me.
So thank you very much, Dr. Ali, for that wonderful discussion we've had tonight. I hope someone's life has been touched, and the lessons learned tonight will be used to impact someone's life outside there. If you're taking care of an elderly person in your society, be it your mother, your father, your grandparent, or even your sister, you never know who you are handling. And so with the discussion we've had tonight, kindly live healthy, and whenever you have the mental instability, speak up, speak out, seek help. And as a result, we'll all have this discussion ongoing. This is not the end of this discussion of healthy living. Our topic for today, let's keep engaging on our social media platforms. We'll be having posters running around across our social media platforms on Ahava Medical Center, which is based in Kisumu, but the kind of services that you can get, you'll get them on our social media platforms. You can follow Daktari on Twitter at Dr. Omamo, Facebook, Kevin Ndai, that's on Facebook. And you can also follow our YouTube channel and our Facebook page, that's The Alternative Voice. For tonight, I've been your host, CLEOPHAS OLUOCH, and subscribe to our YouTube channel. And thank you very much, Dr. for being our guest tonight. It's been a pleasure. Till next time.
Thank you.
Keep safe. Be discreet.
Bye.
Mtaani Quick Auto Spa. We welcome you to Mtaani Quick Auto Spa. Our services include pressure wash, steam wash, snow foam and gentle hand wash, wheel and rim cleaning, tire shine, engine and body wash, vacuum, carpet cleaning, and much more. We apply encapsulation cleaning method to attack all forms of dirt and debris, which guarantee you the best results. We are consistent on quality services at affordable prices. Book an appointment now. You can call, text, DM or WhatsApp 0710 587 285 and we will come to you. All payments will be via M-Pesa Paybill 731-1341. Follow us on our social media platforms at Mtaani Quick Auto Spa.